June 18th. My name is Helen Vits. In this session, we're going to cover COVID testing, particularly as companies continue to plan their return to work strategies, and that evolves. The reality is people are returning to the physical workplaces, and there's going to be a higher chance of positive COVID cases. With testing, there still remains confusion on the efficacies of testing in general between diagnostic, antibody, serology, the CDC recommendations, and availability in general. We want employers to have a solid understanding of COVID testing and how, if at all, testing can be part of your return to work strategy. So with that, I am excited and happy to invite Dr. Bronstein, lead physician in charge at Kaiser Permanente, Antelope Valley. Dr. Bronstein is a pediatric infectious diseases doctor, practicing pediatrician, and along with his medical degree, also holds a public health degree at UCLA. He's a market leader and physician lead for culturally responsive care, performance improvement and innovation, influenza vaccination, and pediatric quality improvement. So Dr. Bronstein, thank you very much for joining our session, and welcome to the Burnham Benefits short series.
Great, thank you. Thank you for having me back here. I appreciate it. So yeah, let's talk about testing. I know there is a ton of confusion about testing and a ton of requests for testing based on just my own relatively small practice, but also talking to my colleagues in all different disciplines within medicine. We're hearing a lot of requests for testing. And so I want to talk about what testing is good for and what testing really isn't good for and shouldn't be used for. And really, honestly, some of the dangers of testing and how to interpret those results. So the first thing to understand is that there are two kinds of testing. There's PCR testing, and then there's antibody testing. Let's start by talking about PCR testing. So for PCR testing, that's the one where you do the nasal swab, sometimes the swab inside the mouth if you're lucky, sometimes an induced sputum where you basically cough up some phlegm. We don't do that one as much anymore. Most of the time it's a nasal swab. And what we're doing with the PCR test is we are looking for the virus itself. Okay, so we are looking to see if you are infected right now with the virus inside of your nose. And so we do that swab and we see if the virus is there or not. That's what PCR is showing us. Now, I know there's lots of people who want to get the PCR and want to get it done, sometimes even more than once. Keep in mind, nationwide, we still have limited capacity with this test. There's shortages of supplies to do it, the swabs themselves, the media, the machines to run it. It's not a simple test to run, and it involves a lot of resources, and there just aren't those resources nationally to do the test on any single person who wants it. Within the Kaiser Permanente system, we are able to now do about 5,000 tests per day for Southern California. That's up from about 2,500 even a week or two ago. We just got one of those new fancy machines and added it to the lab, and now we have the ability to test more than we did before. But even with that, that is still not nearly enough to test every single person who wants a test just because. So we still do have criteria in terms of who we're testing. If you remember before, some of the criteria was very strict in terms of people where either they were about to be hospitalized or they were very high risk due to their medical conditions. Now we've been able to expand those criteria. So we are able to test pretty much anybody who has symptoms that are consistent with COVID-19, but especially those patients where it would make a difference in their management if we need to isolate them, if they need to be, again, in the hospital or those kinds of situations. We do test some asymptomatic people, but that's only for people who are going to be inpatients in the hospital. That's for people who are going to have surgery within the next few days, and for pregnant women who come in and are ready to deliver. Those are the only people without any symptoms that we would actually be able to test according to the current guidelines. And again, these aren't Kaiser Permanente guidelines. These are CDC guidelines, public health department guidelines in order to conserve those tests. The people we don't test still are people without any symptoms. So even if you do have an exposure to somebody with COVID-19 and that other person did test positive and you were near them and you were a close contact, if you don't have symptoms yet, you're not somebody who we would be doing this test on. Okay. Now, in the future, as we get more tests, it's possible we'll expand who can or can't get tested, and it's very likely we will. But right now, again, in order to preserve those tests for the people who need them, we're not testing asymptomatic people. And that goes for us too. Healthcare workers, we're not able to even test ourselves if we have a known exposure. So I think the question about PCR again is, who should we test? Okay, so again, it really comes down to testing those symptomatic people where it's necessary to determine if COVID is causing their symptoms or not. If there's medical confusion and I need to know, is this COVID or is this a stomach bug or is this influenza?
Right.
That's where the testing would be helpful to me. If it's, oh, I got a little runny nose, I think I may have COVID. Yes, you technically have symptoms, so we could test you according to the guidelines, but honestly, most of the time, that's not even the right thing to do. It's not really going to change anything because for the most part, if you're sick, you should not be coming to work. I don't care if you've got influenza, rhinovirus, any other virus other than COVID. We live in an age right now where if you're actually sick with symptoms, you shouldn't be going to work anyway.
What about allergies? As we enter allergy season, there's some symptoms, and maybe remind us what are those symptoms to be considered, not asymptomatic.
Yeah, that's a great question. So allergies can be confusing. Now, for most of us who have allergies, we know we get allergies, and we know that this time of year with all the stuff in the air, we get allergies. And so with allergies, you would have the runny nose, the itchy nose, sometimes the itchy throat, those kinds of symptoms, sometimes the itchy eyes, your typical allergy symptoms. And if that's all it is, honestly, that's fine. Okay, I wouldn't suspect COVID in someone who's got allergy symptoms. It's not someone I would even dream of testing because it's your typical allergy symptoms. With COVID, you would expect some other symptoms too. So some of the things we look for would be fever, of course. Now, not everyone gets fever, but a large number of people do. Sometimes a sore throat, you can see that. You can definitely see cough, shortness of breath. Those are the things where unless they're associated with your typical allergy symptoms and very, very mild, then you would start thinking, okay, this has the potential to be even a mild case of COVID. And when deciding, is it okay to be around someone or not, that's a case where sometimes the testing can actually be useful. Okay. So that's a great question. Allergies can definitely be confusing. But I think the important message here, though, is really if you're sick for any reason where you really suspect infection of any sort, then going to work, going to the store, going to school, any of those activities we typically used to do and just tough it out, we shouldn't be doing that anymore because we can't take the risk of exposing anybody, not just to COVID, but I would hate to give someone else even a rhinovirus, for example, a common cause of the common cold. And then because of that, you just created a whole pandemic of people being afraid in the workplace and then having to run out and get tested and be isolated and all that other stuff because of another virus as well. And that's another thing, which in case I forget to talk about it, getting your flu shot this year is essential because we don't want people with influenza showing up at the workplace and then you have the scare from that as well. Again, I mentioned it, but in terms of people who we should test with PCR, the other group of people are making sure that someone isn't infected at one specific point in time. So those people would be those asymptomatic people we care about because of something they're going to undergo. So surgery, for example, there were studies that came primarily out of China that showed that when they were doing surgery on people who were asymptomatic with COVID and didn't even know they had it, they had significantly worse outcomes. So it's very dangerous for us to operate on somebody who's COVID positive, even without symptoms. So we need to test anybody before surgery. We test people when they're inpatients in the hospital, just so we know how to isolate them more than anything else. And then pregnant women, not that pregnant women really have significantly higher risk, but we worry about could they spread it to their infants, and infants do seem to be potentially higher risk. And so we test all pregnant women before delivery. Now, the biggest question, which I know comes up, and I know you're going to ask me if I don't mention it, is what about if somebody is exposed to somebody with COVID-19? If someone's exposed in the workplace, if someone's exposed at home to COVID-19, shouldn't we test those people? And it's a complicated question. And it really comes down to, first of all, what kind of contact did they have? What kind of exposure was it? And then also if they have symptoms or not. So the close contacts we worry about would be like a home contact. And the definition of a close contact now, which has changed over the past several months, is if you're within 6 feet of somebody for at least 15 minutes. Okay, so within 6 feet for 15 minutes, starting 48 hours before that person develops symptoms. So it's that asymptomatic spread that we worry about. So before they even started having the onset of their illness, if you were around them 48 hours before that, within 6 feet, 15 minutes or more, then you'd be considered a close contact. Now, it doesn't mean that we test every close contact. Okay, now, keep in mind, even if we were to try and test people without symptoms, which again, we don't have the capacity to do that. Even if we were, though, when would you test them, right? That's the big question. And that's why it's not a perfect system to just randomly go testing people who were exposed to close contacts, because it just doesn't make logical sense. So if you think of the virus itself, we pretty much know what the incubation period is. So if I have COVID-19 and I cough on you today, when are you going to develop symptoms? You'll start developing symptoms anywhere between 2 to 14 days is when you'll develop your infection, okay? So when would you test someone? Would you test them at 2 days? That's very early for a lot of people, and they may not be positive. Would you test them at 14 days? Well, if you wait till then, you've already isolated and done all the other stuff you wanted to do, so that doesn't make any practical sense. Kind of the sweet spot is around 3 to 5 days. The problem, though, is even if that's negative, it doesn't really clear somebody, right? Because if you have a negative test at 3 to 5 days, who's to say you're not one of those people who's going to start getting symptoms at 7 days or 10 days or 12 days? You don't know. And so giving someone a negative test that isn't having any symptoms isn't really going to clear someone, because they still have to be on edge. Oh my gosh, I can still develop symptoms even later, even though my test isn't negative.
Is there data between that 3 to 5 days?
Some kind of, sort of, I'd say. There's studies, again, there's data behind the 2 to 14 days.
Okay.
But the 3 to 5 is, you can see studies where they show a lot of people are positive at this point. But again, we're not dealing in absolutes here. And so even though some people, even if it's, I honestly don't know the exact percentage, I know a significant percentage would be positive by then, but not everybody. And you can't take the risk that you still got these asymptomatic people who you tested and are negative, and then they're not going to be following precautions. That's the concern. Okay. The other concern too is, keep in mind the PCR test is not perfect. You can get false negative tests. If I'm going to do a nasal swab correctly, a nasopharyngeal swab to really test for COVID-19, it doesn't feel good. Okay. I really got to go up in the nose there. I joke and say it's a brain biopsy because you have to hit resistance. It's uncomfortable for the people getting it done.
Yes.
It's uncomfortable for the people doing it. I hate that feeling, especially I see kids, and I hate doing that on kids. Keep that in mind. The people doing these swabs may want to be nice to you, and they may not go as deep, and they may not swab as vigorously. And so it's real easy not to get a good specimen, in which case you're going to get a negative result. And again, that test is going to say, hey, you got a negative result, go do whatever you want. You shouldn't, because you can't necessarily test it. You can't trust it.
Right.
Plus the test isn't perfect. Okay. So you can have false negatives for a number of different reasons, but that's the reason why, first of all, again, if you test too early, too late, whatever, or if you get a false negative, relying solely on a test to decide, can someone go back to work or not, it's dangerous. Honestly, it really is. And you're giving people this false sense of security. And that's why what we recommend, and not just us, this is what the CDC recommends, is other options. In a perfect world, let's say the economy didn't matter and it didn't matter if we had our employees at work or not, then we would say anybody who's exposed, let's be on the safe side, let's quarantine them. And quarantine, remember, quarantine is when you don't have symptoms. versus isolation when you do have symptoms, but you would quarantine someone for that full 14-day period.
Right. 2
Then
weeks
you're
off.
safe. Either they develop symptoms or they don't. That's reasonable for some companies. For many, it's not. In healthcare, that's not what we do because we wouldn't have any healthcare workers. Okay.
Mm-hmm.
So what we do, which is what I would recommend for most industries who can do it this way, is what we would refer to as self-monitoring at work. So you would basically tell someone to continue working, but you're going to check your temperature twice a day to make sure you're not developing symptoms. You're going to really think about symptoms a few times a day. So the cough, shortness of breath, fever, are you having any of those? In addition to weird things like loss of your sense of smell, loss of your sense of taste.
Mm-hmm.
Those, as far as I'm concerned, if someone has those symptoms, I still don't need to test them because I assume they have COVID-19 because it's such a rare thing to have, but it is something that's, I wouldn't say common with COVID-19, but we are seeing that. So have the people basically go to work, check their temperature a few times a day or have them self-check, have them self-monitor for symptoms. If they develop symptoms, obviously, then they go home, they're isolated for the 10 days and that's that. But if they're not having symptoms and they continue to work and, you know, if they're not having symptoms and they're not developing COVID-19 over the next several days, that's fine. That really is. Now, it's fine because we're all taking necessary precautions as well. Now, these people in particular, they need to obviously be wearing the mask. Now, all of us should be doing that. And that's why we're all doing it, because I don't care who you're exposed to. You can have an asymptomatic case of COVID-19 and not know it, not know where you were exposed, who gave it to you. And that's why I don't want to spread my germs, even if there's no COVID in there. I don't want to spread my germs to another person. I wear a mask.
Correct.
The other person should wear a mask. Everybody should be wearing a mask, but especially those people who have a potential exposure, they need to be extremely vigilant and careful about wearing a mask, hand hygiene, all those things all of us should be doing. They really need to be doing it because the understanding is, you know, we don't want to take any risk of them transmitting the virus. And the reality is, even if you're asymptomatic with COVID-19, if you're following all those precautions, more than likely you are not going to expose someone. It's really unlikely. It's really rare. And that's where the masks have actually been tremendously helpful. When people at work pop up with COVID-19, the vast majority of them got it from home, from someone who wasn't being careful in the house, which makes sense. We're not wearing masks around the house. So, so that's the important thing to remember is, again, the test, to me, it wouldn't give me any additional information if someone can go back to work or not. I mean, obviously, if it's positive, okay, fine. But for the vast majority of these tests, which are going to be negative, you can't even trust that negative result. And that idea of, you know, the 3 to 5 days, you're not going to test everyone every few days. It just doesn't make sense. I mean, maybe in the NBA, you're going to test right before a basketball game every time. That actually makes some sense. And if they got the resources, go for it. But for the rest of us, it just doesn't make sense that we can test frequently when, again, we don't even have the resources barely to test the people who have symptoms.
Is it more of a sense of comfort then for employers to do that? Because there's a hotspot of positive cases and then everybody in their employment wants to be tested. And so the employer does it for peace of mind.
Right. They think it's giving them peace of mind. The problem is, again, if they don't understand exactly what they're testing, maybe you're testing at the wrong time. Maybe you're getting a false negative. Maybe you're giving people a false sense of security. Maybe you're creating scare. All these things are unfortunately reasons why, even though they think it's the right thing to do, for the vast majority of cases, it's not the right thing to do. It's not going to help. Instead, if you want people to say, hey, we have an exposure here, fix it, just like we do in healthcare. Again, we're around COVID more than anybody else, but our solution isn't to test ourselves all the time. Our solution is to take precautions and be very vigilant about developing symptoms and things like that, and not going to work sick. But self-monitoring, wearing the mask, doing all those safety precautions. And because of that, we can continue to work in this environment, knowing that we are going to get exposed frequently. That's okay because we're taking adequate precautions. So that's the difference there. I know the confusing thing, and it really comes down to that question of how do we clear someone to go back to work, right? How do you, once there's an exposure, how do you clear someone to go back to work? Or more importantly, if someone does test positive, how do we let that person go back to work? And it's really the same question. Do you test to show that the person who had COVID-19 before is now negative and they can go back to work? Or is there a better way? And the reality is there's a better way. Because let's say I tested positive for COVID-19 and I did the right thing and I isolated myself. How do we determine that now I can go back to work and start seeing my patients again?
Mm-hmm.
So on the one hand, you would think, oh, just test me and see if I'm negative. The problem is, again, false negative. If I get a false negative test because someone didn't swab me properly or just the test isn't perfect, I'm going to go back to work and I'm going to expose people.
Right.
The other problem is persistent positive tests. This is something we don't talk about enough, but we need to. Let's say I've been in isolation for 10 days and now I do a test to show that I'm clear, and guess what? It's positive again. These tests can actually stay positive for months even, 6 weeks, 2 months. We see cases where we just don't see it clearing from the nose. Does that mean I'm still infectious? The answer is no. I'm not infectious, even though I still have PCR particles in my nose, basically.
Okay.
I'm not infectious, because if you look at how coronaviruses behave, if you look at basically how most viruses behave, and there's no reason this would be differently, really by 10 days or so, you're no longer infectious. You're no longer going to spread the virus to other people. And so rather than doing this test where, first of all, you may not believe it if it's negative, and even if it's positive, it's not going to change anything in terms of should I go back to work. The better way to get someone back to work who has tested positive before is to do what we call the symptom-based strategy of discontinuing isolation. This is straight out of the CDC, but the idea is, but it's based on what viruses do. So 10 days of being isolated, okay, and then also 72 hours without fever, 72 hours without any respiratory symptoms like the cough or the congestion, things where you can really spread the virus. If you've been without those for 72 hours and you've been isolated for at least the 10 days, you can go back to work. And a PCR isn't going to help. In fact, that's just going to confuse things, especially if it stays positive for too long, in which case there's really no clinical understanding even of what that means. It doesn't seem to be infectious. So really following that 10-day rule is so much more important. The funny thing about the 10 days is if I have a COVID-19 infection, I wait 10 days, I'm no longer having symptoms for those 72 hours, no more fever, I go back to work. That actually can be a shorter period of time than someone who actually was quarantined and stayed at home for 14 days after an exposure, waiting to see if they develop symptoms, right? So I know it's kind of hard to get your head around that, but that's just the way it works out according to how the virus behaves.
Well, it's so funny. You cannot just talk about testing though without talking about all these other, means of trying to get somebody safely back to work or just being in a safe environment. So that's just the PRK testing or diagnostic testing, right? What about all this antibody, serology, and where's the blood testing come into play? Can you touch on that?
Absolutely. Let's talk about antibody testing. I think I've said everything I possibly can about PCR testing. So let's put that aside right now, and instead let's talk about antibody testing. Okay. Now, for most of us, the antibody testing is even less useful than the PCR. Okay. So hopefully I dispelled some of those myths about PCR. Let's talk about antibody testing because there's so much confusion on this. Okay. Even among medical professionals, okay, they're calling me all the time asking for advice because they don't fully understand it. It's very confusing. So let's talk about that. So first of all, what is an antibody test? So antibody test is the same as serology. If you hear someone use those two terms, they're synonymous. And it is a blood test. Okay, so we're no longer looking to see, do I have virus in my nose? We're looking to see, does my blood have evidence of antibodies against the virus that causes COVID-19. And so it's really looking to see, did I have a past infection with COVID-19? Okay. Now the first question is, can we get an antibody test? And the answer to that is yes, you can. Okay. Doesn't mean you should, but you can. Okay. So at Kaiser Permanente, we now have it internalized. It took us a little time because, as you know, what happened with antibody testing is it was the Wild West initially. Every company was able to put out their test, and the vast majority of them were absolute garbage. Okay, they weren't specific to this specific coronavirus. They were detecting coronaviruses you may have had many years ago, false positives, false negatives. They were terrible tests. So we took our time and we actually studied 4 different types of tests and ran all sorts of serum through them and checked them internally and externally. And we found really a very good test to use. So we're comfortable with the test we're using. It's the one by Abbott, in case you're reading about antibody tests, where it actually has very good. Yeah, so they've got a decent PCR test where it's a rapid one, but they also have an antibody test that has very good sensitivity as well as specificity. So sensitivity is basically where you're trying to detect the virus. Okay, so if it's sensitive, it's going to pick up even a little bit of virus. If it's specific, that's more important with an antibody test, not just that it's sensitive, but that it's specific, that is not giving you antibodies from other viruses, just specifically antibodies from the SARS-CoV-2 virus, which causes COVID-19. So the test that we're using is very good. Now, according to the CARES Act, that national act, anyone who wants an antibody test can get one.
Right, it's covered.
Okay, so if you call up, covered, yes, that too. But if you call up Kaiser Permanente right now and later, if you go online and click a few buttons on kp.org, you can order yourself an antibody test, basically. Now, right now, you still need a doctor's order, but eventually it's going to change where anyone who wants one can get one. But I would caution you here, and that's why we're having this conversation, right? Just because you can do it doesn't mean you should do it. Now, with the PCR test, some people can get it if they have symptoms. Some people really can't and shouldn't if they don't. With the antibody test, anybody who feels like getting a blood draw theoretically can get the test done. The problem, though, is for most people, it's not a good decision. So let's talk about why that is. Really, there's really only 2 uses of the antibody test that make any sense to me and really anyone in this medical specialty here. There's only 2 good uses. One is if you want to test the whole population. So if you want to test the population of Orange County and you want to see how many people have antibodies against it, just to know what rate of people got infected over the past several, months, then you do antibody tests on everybody or a certain segment of the population that's representative of the whole population. That's useful at the population level because there's going to be all sorts of errors, there's going to be all sorts of false positives and stuff mixed in that data, but you can account for that and you can make estimates based on that. I also use the test if I see a child who I'm concerned about having that multi-system inflammatory syndrome you may have heard about. Those kids who the MISC who are very, very sick with something like Kawasaki disease, which I'm not going to go into detail, but it's really awful. It's terrible. And those kids, the current thought on it is they had COVID-19 a month or 2 ago. And now their body's having a late inflammatory response after they've already cleared the virus. So if I do a PCR test on them, it's not going to show COVID. They've cleared it. They're done. This is their body's immune response a month or 2 later. And the only way to know if they had COVID-19 before or not is to do an antibody test. And so that would be useful for me deciding, is this MISC or is this run-of-the-mill Kawasaki disease or is this some other random fever-generating disease? So those are the 2 cases that it's a useful test. Everything else, every other reason someone wants one, it does not make sense.
So I think a lot of,
why that is.
Well, before you do that, you're probably going to answer it, but a lot of people were doing it because of the sense that if I had it already, I'm not going to get it again, which means, again, a safety check. I can now hang out with everybody else who had it in the past. So go ahead, Dr. B.
So that's absolutely not the way to go. And let's talk about that, okay? So the antibody test, if used improperly, especially in the case you're saying where you're using it as this immunity card, an immunity passport, I can now do whatever I want. You got to wear your mask. I'm not going to wear mine because I'm totally safe. I've had it before. I'm not going to spread illness. That's extremely dangerous. Okay, and the reason why that's dangerous, number one, is the rate of false positives. Okay, so again, with PCR testing, what was our concern? We were concerned about false negatives. If you got a false negative with PCR, even though you're really positive, you're spreading the disease, that's a problem. With an antibody test, again, you're trying to show that you're immune to the virus. You're not trying to show you're infected, you're trying to show you're immune. And if you have a positive test which shows, hey, I had the virus before and now I'm cured, basically, that's dangerous if you have a false positive. So does the test have false positives? I mentioned that the specificity is like 99%, at least on the tests that we use in Kaiser Permanente. What's the risk of a false positive? Well, it all depends on the prevalence of the disease in the population. So in LA County, for example, they recently did some studies where they tested a whole lot of people, and they showed that the prevalence of disease here is around 4%. Okay, 4% of people have had the infection, the rest haven't, which makes sense. In countries like Sweden, for example, I don't know if you read in the news, but Sweden thought, oh, we're going to give everybody herd immunity.
Right.
And so we're going to let everybody do whatever the heck they want and develop immunity, and then we'll be fine. Now, first of all, they had higher death rates than almost any country in Europe. But besides that, so that didn't work. But did it work giving them herd immunity? 7% of their population wound up with antibodies. 7%.
That's well, that's pretty
so
small.
93% of their population isn't protected. For herd immunity, you need 70%.
Okay.
So they're way off. Now, us in LA County, where we actually did social distance and stuff, we were pretty good. In LA County, we were about 4%. My guess for Orange County, I know most of you guys are in Orange County there, it's probably even less than that. So let's say you're around 4 or 5%, okay, prevalence. When you do this test, what we call the positive predictive value, if you have a positive test, is it predictive of having actual disease or not? I ran the numbers actually this morning based on, I did LA County numbers, for example, with a population of 10 million, whatever. When you do those numbers, you see that basically 1 out of every 5 people who get a positive test result, 1 out of every 5, it's a false positive. Okay? If you have lower prevalence of disease, so let's say your prevalence is down 3%, it's going to be more than that, maybe 2 out of every 5. If you have a test that's 95% specific, which a lot of the other tests that are used are 95%, you say, oh, that's pretty good. That's close to perfect, 95. It goes down to a coin flip. Wow. 1 out of every 2 people, basically, 1 out of every 2 people, it's a false positive. So if I give a patient the result, or now if they automatically generate a result from them ordering their own tests, and it says, hey, you're positive, how do you know to believe that or not? You don't. Yeah. The only way you know you had it before is if you actually had it before and someone tested you and your PCR was positive, then you know you had it. So the risk of giving someone a false positive test is unfortunately very likely. 1 out of 5, I wouldn't take those odds and bet my life on it. And that's dangerous. The other confusing thing about antibody tests, which is probably even more of an issue, is even if it's a real positive test, so you're that 4 out of 5 people who had a test and it was positive, what does that mean? I don't know. Nobody knows. What does it mean if you had a positive antibody test? Does it mean that the antibodies you have are protecting you against COVID-19? Right. It's too early to say. We don't know if these are even protective antibodies. There's certain things like HIV, for example, where you make wonderful antibodies against HIV, but they don't do anything to clear the virus. They don't do anything. And so we don't know what the antibodies mean. We don't know how long they're even going to stick around to protect you. So you may have a test today, and then let's say it's just short-term immunity, and then a few months from now, you think you're fine, and COVID is still circulating, and guess what? Your antibodies wore off. We have no idea how long that protection even lasts. The other wrinkle here, which again, people don't think about and don't talk about nearly enough, is when do you develop this antibody response, right? Do you develop it after you've had an infection and the infection's already cleared, and then you start making antibodies so your test is going to become positive? Well, that happens in some people. But for the vast majority of people, you start making those antibodies when you're sick. So if I'm sick and someone exposed me to COVID-19 and I basically am infected with the virus right now and I don't have any symptoms, but I say, hey, I want to check my antibodies. I go check my antibodies, they could be positive because my body's trying to fight off that asymptomatic infection that I currently have. I can have a positive antibody test at the same time I'm sick with the virus itself and can be spreading the virus. So I can go to work and say, hey, I don't have to wear my mask because I have a positive antibody test, without knowing that I'm actually sick at this exact point in time and spread the virus to people. So again, nothing about this, to me at least, and to most of us in the medical community, nothing about this makes sense in terms of a test that can in any way, shape, or form be practical to make decisions about who can go to the movies and who can go out to eat without a mask on or whatever. It's just, there's just too much confusion there, right? So I know I wouldn't bet, you know, my life on it. I wouldn't tell my mom, my elderly mom, for example, hey, you had a positive antibody test, do whatever you want. You can go grocery shopping again. I wouldn't tell her that, because knowing what I know, and hopefully all of us now know about these antibody tests, they're not trustworthy. Even a perfect test, even a test that is near perfect, like the one we're using, I mean, it's as good as it gets. There's still tremendous confusion. Now, if we had, you know, 70, 80% of the population, for example, that had been infected already, and you want to see if you're one of those 20% who hasn't had it yet, then the prevalence is increased. The risk of a false positive would significantly go down. And at that point, you can trust an antibody test. But we're nowhere near there, right? So right now, these antibody tests are just, they would create more harm than good. And the fact that anyone can get one whenever they want, and then start making assumptions based on that, to me, that's just pure danger.
Well, that's probably why the CDC did not recommend serology or antibody as like a return to work strategy. Not using it.
It's not for, we don't use it for a return to work strategy. We don't use it for a travel strategy, a go out in public strategy. And most importantly, we in healthcare don't use it for a diagnosis strategy. Again, those two cases I told you about, really only one of them is a clinical case for the kids there. Everyone else, it's not recommended. It's not on the list of tests that I should even be ordering as recommended. The only time I would ever order a test is if a patient says, I really want one, do it for me. And then I have no choice because that's the law. But medically speaking, it's not going to give me any useful medical information to make decisions, even about the sickest of sick patients. Sometimes we do it out of curiosity, but when you wind up with a test, you don't even know if you could trust or not. So what's the point?
Well, I think this brings up so much, you know, like the return to work strategy is a multidisciplinary strategy too. Like, and what I've taken from this is there's so much to learn, and people need to understand, you know, this entire conversation about testing and why it's not really a one solution. Like getting a test doesn't really help to do really just sounds like doesn't help to do much as far as a day-to-day person. But training to me seems to be a huge, you know, probably a primary goal for all employers, and to go back and educate their workforce on COVID-19 and how we're being safe with each other, how the company's being safe, and when are we going to test, or really like how are we not going to infect each other. And so just a lot of education still, like what are the symptoms, who's sick, keep the mask, the distancing, and those things we assume should be happening.
And basically it's, you know, the way I see it, you do what you do and we do what we do. You know, when it comes to the testing and deciding would a test be helpful for somebody, that's what we as doctors do. You know, regardless of what test it is, whether it's a COVID test, an influenza test, anything, we are very good at deciding, is it going to help make decisions for you? And what I would say is trust us in that. If we're telling you it's not going to be helpful for you, you know, it's not going to be helpful for you. That these are the things that we consider and know. At the same time, you know, I can't go to your workplace and make sure that everybody's wearing their mask and make sure that everyone's keeping 6 feet apart and washing their hands and that's your responsibility, and every individual's responsibility, every employee's responsibility, and every employer's responsibility is making sure that you follow the rules, but you follow them in a way that makes sense. So right now, when we're in a world where you can spread the virus without even knowing you're sick, and the main way of spreading the virus is, the respiratory route, by coughing, sneezing, just even talking in close contact to someone with droplets. Exactly. The best way to protect against that is wearing the mask. And I know people don't like wearing masks, and I hate wearing masks, honestly. I have to do it all day, and all of us do now in certain respects. But even before, when I'd have to, as a medical student, I had to stand through those long surgeries doing relatively little as a medical student, having to wear that mask all day. It's rough. I get it. But if we want to keep people safe, we have to do that, because that's, again, how the virus spreads. It spreads by the close contact, and we need to interrupt that transmission. And remember, when I wear a mask, it's not to protect me. I wear the mask to protect you from my droplets. You wear the mask to protect me from your droplets. And we have to have that sense that we're taking care of each other. And so I know there are people who think, oh, I don't have to wear a mask, I'm special, I don't go follow these rules. Well, those are the people that are then infecting you. Even though you're doing your part by wearing your mask, they're not doing their part. Right. So, yeah, and the more we understand about how this virus is transmitted and what the real risks are, the more we understand what we have to do in the workplace. I know people worry about surfaces as well. I think there's a lot less concern about surfaces than there were before. And yes, you want to still wipe down things and make sure that the surfaces are clean, and make sure that, we're washing our hands whenever you're touching something, and making sure that you're clean. And that's more of, honestly, a personal responsibility, not touching your face, keeping track of what you do touch, and doing very good hand hygiene. That's kind of your personal responsibility, where you can take your own control. But when it comes to breathing, and it comes to being close to people, and it comes to, again, spreading these droplets without even knowing that I'm sick, that's where the masks come into play, and that's the most important thing.
Okay. And masks, especially when you cannot socially distance, which is the 6 feet. I mean, if you're walking outside and you're 12 feet apart, do you wear masks at all times? Right. It's really when you can't distance, you're close, so you have to wear a mask to protect each other.
Absolutely. But always keep in mind what you're doing when you're distancing too. So, I'll go bike riding without a mask. I'll go running with my buddy without a mask. These are things that I'll do. I'm comfortable with that. Outdoors is safe. I'm really not worried. However, if you're, outdoors and in close contact with someone, then you need to think. So for example, I take a martial arts class, and in the evening, or this wasn't the evening, sorry, this was on a Saturday morning, we go to a park. And they decided to do it outside at the park. And for the most part, we're distanced, and we're more than the 6 feet, because keep in mind, if you're doing martial arts and you're yelling and screaming and breathing heavy and tired, those droplets can shoot farther than the 6 feet. So we keep really good distance. But then when it comes to, someone holding the pad for me, and I'm kicking or kneeing the pad, for example, and I know I'm right up in their face, even though I'm outdoors, and even though maybe I've got long legs, so maybe my feet are, almost 6 feet apart, I don't know, I put my mask on to protect the pad holder, because I don't want my droplet spreading, because we're in close contact. So there can be a little bit of, use your common sense.
Right, judgment call.
And again, and there's no guarantee about 6 feet. I know we talk about 6 feet, but that's not referring to people who are screaming, people who are breathing heavy, people who are, singing, for example. I think singing's become the new dangerous activity, unfortunately. But the 6 feet is just a guideline for typical casual conversation, how things are spread. But use your judgment. And again, the more we wear the masks, the more socially acceptable it becomes. And, when there's no stigma to saying, hey, I'm just going to make sure that I'm protecting you by putting my mask on, hopefully we all do the same thing and help each other there. Because that, more than anything, and they've done some more recent studies on that you may have heard about, showing that even with social distancing, even with good hygiene, all the other stuff we do, none of that is a substitute for masking. Which is good, because honestly, we didn't know how effective these cloth masks would be in the beginning. I mean, we
Right.
hope they would be, but when you compare it to other things like, the fancier masks and things, we just weren't positive. For the most part, they look like they're being extremely effective. And so wearing just the plain cloth mask, unless you're in high risk situations, is totally fine. And it just goes a long way, more so than just the distancing and all the other restrictions that we've put in place.
That's all good to think about. I wear my mask as much as I can too, especially out when I can't distance. And honestly,
No.
we're not seeing a lot of people right now, so we have the benefit of that. But especially with healthcare, you guys have been doing it. You haven't had an off. It's been ongoing. So I think that is reality for you guys from day one. But I want to kind of just wrap this up. But if you have anything to say about testing, I think it's just there's just, to me, it doesn't really help much, the testing, from what I'm hearing. And kind of have to collect my thoughts about it and how to really work with employers, because that is something that they think about often, and how they put on the return to work strategy, where really it just seems to be a small piece of the puzzle or small piece of the strategy. There should be probably 95% of other things going on, to really have an effective and safe workforce. So with that, do you want to end with anything, Dr. B?
Yeah, I mean, I basically what you said, I think, was a great wrap up. But the idea of getting your employees back to work, there are wonderful ways of doing it. There are very strict, clearly delineated ways of doing it. If you look at the CDC website or the state of California, there's great ways of getting people back to work that don't involve testing and that make a lot more sense than testing.
Mm-hmm.
Okay, so follow those guidelines. Don't give into that knee-jerk reaction of, oh, someone was positive, now we got to test everybody. It's not helpful. Okay, and again, I wish we could test anybody who possibly wanted one, but the reality is we're constrained, and it's not just us, it's everybody right now in terms of testing asymptomatic people. And so we will test if there's symptoms if it makes a difference. We're not going to test people without symptoms just because someone wants that test. The flip side of that is, of course, the antibody test, where we will test anybody who wants it, but the reality is none of you should want it. I mean, it's not going to help. Don't want it. Don't put yourself through it. Don't put your kids through a blood draw that they don't want. It's not going to help with any sort of decision making. It's just going to cause confusion. So even though we could do that test, why bother?
Right.
Don't put yourself through it. So, and if there's ever any questions, ask us, ask me, ask your doctor. We know these things. This is the stuff we do all day long, and we can really help decide if a test is going to help or not, or if there's a better way to get someone back to work again.
Thank you so much, Dr. B. I think this was super helpful, and it took a lot longer than our original short series. So, but I really appreciate it. I think there's so many more questions that come up outside of just testing, but this helps a lot. I mean, personally for me, I think a lot of employers and our clients and prospect clients would appreciate that. So thank you so much. Hang on, I'm going to go ahead and wrap this up. Thank you everyone for joining this Burnham video series.